So how should we and how do we help trainees feel important? We built a really specific educational program for and around them, and we take their feedback really seriously. So it's primary in the department.
Our education curriculum is called Thursday University. Thursday mornings, the residents have protected time from 7 a.m. to noon, and that includes grand rounds and M&M, but then also we have structured teaching for them.
I think it's very nice to have a time when we turn our pagers off and we don't have clinical responsibility for those 4 hours, and we can really focus on what our education is for that day.
Our didactic sessions cover a variety of topics. So we might, on 1 week, talk about new research in the field. We might talk about medical education. We might hear grand rounds from our chief resident or from a visiting professor from another university.
We tend to have lectures that are subspecialty specific, but apply to generalist practice. And sometimes they include like cost awareness or how to do a well woman exam and billing and running a practice, and so things beyond just like how to practice as an OB/GYN.
We have journal club through the residency program itself, kind of through our research curriculum that's often held during our Thursday didactics. I know some of the subspecialties also invite the residents to their journal clubs. So for example, Gyn-Onc opens up their journal club events, which I think are monthly, to any of the residents, and that kind of allows for some social time and learning time outside of work.
Within the OB/GYN Global Health Tract, we do journal club where we read an article on like a global health topic, and we have dinner together with the faculty mentors and us residents.
Simulation is a really big part of our educational programming. Each year we continue to add more and more simulation to our curriculum, and we really look to the senior residents to help the faculty to teach the junior residents some of the simulation exercises.
All of our simulations are directly related to things that we would be exposed to in the operating rooms themselves. So we do things like minor gynecologic surgery like hysteroscopy, as well as more major surgeries like total laparoscopic hysterectomy or total abdominal hysterectomy. And I know that our senior residents get engaged in also cesarean hysterectomy as well.
We have a couple different options for simulation here at UW in the OB/GYN department. One, we have the UW Sim Lab over at the University Hospital campus that we have access to 24/7. They have a Da Vinci robot simulator, they have laparoscopic simulators. That Sim Lab is for all UW residents, but we also actually have our own dedicated OB/GYN Sim Lab here at Meriter Hospital that we also have access to 24/7. We have laparoscopic trainers, we have different mannequins where we can practice, breech vaginal deliveries or postpartum hemorrhages or things like that, so that we can kind of figure out what we're doing and get the nuts and bolts down before we actually go to the OR.
We have already transitioned from FLS, or the Fundamentals of Laparoscopic Surgery, to EMIG, or the Essentials in Minimally Invasive Gynecology, and we have different box trainers or laparables for the residents to practice their EMIG skills, so that when it comes time for them to take both their cognitive and skill exams, they feel very competent and ready for those exams.
The simulations provide us a chance to start to build trust with our attendings to see us do these skills, and so that when we get into those situations in a real clinical setting, there is already a base level of trust, which allows increased patient safety as well as better training and learning for residents.
I would say the vast majority of rotations have some structured teaching associated with them. For clinic, we actually have an ambulatory curriculum, and so for 15 minutes before clinic, we do case-based learning, and the residents are expected to listen to a podcast before clinic to prepare for that learning.
Medical students rotate with us on a number of our services. I think it's an awesome opportunity to be sort of a near peer mentor and help with their education. So medical students are integrated into the program in ways I think that enrich the experience for them and for us as residents.
I think we have a really positive structure of kind of graduated opportunities that at the later levels in residency, you have the opportunity to begin teaching your peers. I think at Thursday didactics and our simulations as well, oftentimes we'll have like faculty-led lectures and simulations, but then they also oftentimes will encourage us to have the upper level residents pair with the lower level residents, which gives them kind of like a teaching experience as well.
We have recently just revamped the Thursday University curriculum. It's intended to cover kind of all of the ACGME, learning objectives and milestones for OB-GYN, and to make sure that they're well prepared to take their CREOG exams.
Usually in the couple months leading up, our Thursday morning didactics will be more focused on lectures and practice questions related to CREOGs. And we also, on most inpatient services that we have didactics once a week or daily on those services. So on those services, we'll also do like more CREOGs oriented didactics in the months leading up to CREOGs. So doing practice questions or talking about like topics that people are more concerned about for CREOGs.
I think people should know that the program places value and emphasis on providing education outside of clinical experiences. And I think that helps prepare us to be contributing members to the field of OB-GYN and enriches the experience in residency.
I think the most important thing is that our program leadership are very responsive to feedback on our curriculum and like what we are looking for in our education. And that's something that I value a lot.